The biggest financial scandal in Cornwall and still happening today. God bless Alan Bates, you are not alone. Continuing healthcare scandal in Cornwall, NHS, KCCG fraud, adult social services fraud. But remember, you are the victim here, you have done nothing wrong. Illegal adult social services financial assessments. Got any bank statements, Louise Rocket? You committed fraud. Cornwall Council head lawyer Alan Perry putting a charge on people's property with no notification, no signed contract. Totally illegal fraud. NHS KCCG praise surgery. Assessments fraudulently downgraded to deny needs. The only thing necessary for the triumph of evil is for good men to do nothing. Council withheld mum's care records, medication charts, all records of her falls, aggression, while staying at Trevula Nursing Home St Day. Why? Why withhold records that somebody is entitled to? Hello there. People talk of scandals and they're disgust at how they can happen for long periods, years, even decades before coming into the public domain. Well, there is one that is happening in Cornwall now, tomorrow, next week, next month. And the most astonishing thing is that most people have family, friends, neighbours that have been victims of it, yet they feel there is nothing they can do. And as an individual, this has been my experience, as to complain about those committing these crimes and denying people what they are legally entitled to, you have to appeal to those very organisations. Continuing healthcare is free to anyone with health needs, physical or mental. The KCCG Kerno Clinical Commissioning Group, now called the Integrated Care Board, should assess people, let's say leaving hospital. They should carry out a needs assessment. And if people have health needs, let's say dementia, they have no cognition, no mobility, doubly incontinent, they have a minimum of 3 up to 5 carers at any one time to ensure their needs are met. Unaware of their continence, needs, at risk of developing skin infection, pressure sores, damage, due to their lack of mobility, is wholly dependent on others to administer medication, is non-compliant to administer medication, is non-compliant with accepting oral medication and has a covert administration of medication procedure in place. This was a real person. This was my dear late mum, Gwendolyn Joan Dunstan, one of many, many victims, gone through this, still going through it, and yet to go through it. Mum fell at home, broke her hip, spent 105 days in Cornwall's hospitals, and looked after by the best committed professional staff at every level within those hospitals. After 105 days, you feel the staff would know mum's physical, medical and mental health needs, as is logged in mum's hospital records. Mum had 3 carers, shouting, spitting, restraint needed to give care required. Patient incontinent, took 4 staff. Mum hitting out, spitting, stamping on feet. Patient restrained on toilet. Assistance of 3 needed. Patient was angry, spitting, stamping, hitting, may have been scared. Patient was hitting out and kicking spitting, biting, sitting in bed screaming. Clearly not the same actions of maybe someone requiring social care. West Cornwall Hospital is trying to get Mum placed in a home. But after all the homes turn Mum down because her needs are so severe, they remove Mum from the brokerage list. And the hospital records 2nd of August state, no longer suitable for a package of care due to needing 3+ carers after 4+ carers on the ward. Due to current needs, I have been unable to source a home that will consider assessing or accepting Joan. Discussed at MDT, a referral needs to be made to the complex care and dementia team and admission to Garner ward. This is a ward at Bodmin. This is for people with severe mental health. This is the end of the line. Hospital record 3rd of August. Referred to complex care and dementia team. Paul Gibson, CPN, community psychiatric nurse, to visit ward tomorrow to assess Mum for Garner ward. 9th of August, Ruth Pollard states in phone call she needs to speak to the CHC team and mental health team, as Mum's needs that she's got that are complex are relating to her mental health rather than her social care needs. Quite clear, quite specific. Ruth Pollard was the hospital social worker, also in charge of her discharge. On the 11th of August, Ruth Pollard's manager, Annette Caston, agrees with Ruth's assessment of my mum that she has severe, complex mental health needs. Ruth reiterates about Mum's mental health needs, significantly worse since her fall in May. An adult needs assessment dated 14th of August by Ruth Pollard states, I am concerned that with the level of Mrs. Dunstan's agitation and the risk that this poses, not only to others but also to herself, and the level of intervention that Mrs. Dunstan is requiring to meet her needs at this time, that this is above what can be safely care planned by adult social care. Now, sadly, the KCCG appear on the scene. 15th of August, Ruth Lewis states, currently funding for placement is being disputed between health and social care at a higher level, and the ward are awaiting the outcome. August the 15th, funding now with Trudy Raymond, who works for CHC. Last entry in Mum's records, August the 16th. Funding agreed. Aim for discharge to Trafula on 18th of August. So we assume, because of her severe complex mental health needs that the hospital were fully aware of and reiterated to the KCCG, who decide who gets the continuing health care. We assumed Mum was going to the home with these needs. August 21st, Manor Surgery records. Mrs. Dunstan was discharged to Trafula Nursing Home for placement funded by adult social care, which was clearly stated was above their legal remit. And this is legally breaking the framework, breaking the law. This is fraud. Now, this has obviously happened to lots of you. Various other things, charges placed on your home without knowing it. Your loved one passes away, you go to sell your home. You receive a letter, probably from saying there is a charge on your home. For this to happen, for a charge to be placed on your home, there needs to be a legal contract signed. No contracts are signed. This guy, these people, just think they do what they want. And as I've said, to complain to them about them, you have to complain to them. Now, don't despair, there is help. Now, what I want you all to do is to please get in touch with your story. And like the Cornish do, we stand together and we speak as one, and we make these lawbreakers face justice for their crimes. So God bless you. Do not give up hope. There is a website, and I'll give you the address. It's https://nhsbiggestSecret.weebly.com. Go onto the address, upload your stories. Let us try and help, and let us get together and put an end to this illegal and vile practice. And please pass this on, share this on any social media site you have my full permission, with my mum's details disclosed. Please share this to anyone and everyone. I'm sure there are loads of you who have been affected. And please come forward and stand with us. We are starting to get somewhere, but we need numbers. So please come and we will support you. God bless you one and all.